presenter, Jolie Siegel.
Thank you, Charisse. Welcome to the training session on weekly influenza vaccination data reporting through NHSN. My name is Jolie Siegel, and I work in the Division of Healthcare Quality Promotion at CDC. I will be presenting information during this session. There are 3 objectives for today's webinar. The first objective is to discuss why reporting weekly influenza vaccination data is important. Next, we will review how facilities can use NHSN to track weekly influenza vaccination data for healthcare personnel. We will then review data reporting in detail, including the new ability of users to upload data via CSV documents. As of January 2022, CMS and ESRD mandated that dialysis facilities must report cumulative flu vaccination data for the last reporting week of the calendar month for the 2021-2022 flu season. Please note that a week belongs to the month of the week end date. For example, if you submit data for the week of February 28th through March 6th, the data is considered as being submitted for a week in March. The deadline for facilities to enter all months of data is April 15th, 2022. To make it easier for facilities to understand reporting requirements, we have listed the dates for the weeks which data should be reported for. If you have questions about reporting requirements, you may contact your ESRD network. As a note on reporting, please keep in mind that freestanding individual facilities should enroll and report separately in NHSN with separate org IDs. This is true even if the physically separate facilities share a single CCN. Now we will go over how NHSN data can be used to improve influenza vaccination coverage. You might be asking what the benefits of reporting in NHSN are. Firstly, the NHSN modules are designed to ensure that influenza vaccination percentages are both consistent over time within a single healthcare facility and comparable across facilities so users can track their progress each week as well as benchmark vaccination rates against other facilities. Additionally, using NHSN to monitor influenza vaccination among HCP may also result in increased influenza vaccination because improvements in tracking and reporting HCP influenza vaccination status will allow facilities to better identify and target unvaccinated HCP. Lastly, increased influenza vaccination coverage among HCP is expected to result in reduced morbidity and mortality related to influenza virus infection among HCP. There are several ways facilities can put these data to good use. NHSN now allows facilities to monitor vaccination trends on a weekly basis to see how rates are improving for different HCP groups. The data also will show if there are certain groups with lower vaccination rates. For instance, A facility might note that technicians have consistently lower rates of influenza vaccination than nurses. Reviewing the data may also help facilities identify barriers to influenza vaccination. The facility in the above example could determine that vaccination rates are lower among non-employees because they are not covered by facility policies and programs related to influenza vaccination. Facilities could also use NHSN data to help them make decisions about efforts to increase influenza vaccination among HCP. For instance, a facility could update its annual vaccination campaign to cover employees and non-employees, or could increase the number of days vaccination is offered to HCP. Or the facility may decide to improve their internal tracking systems. For example, turning to computer-based or automated tracking systems to better identify unvaccinated HCP in real time. Now we will briefly go over the requirements for weekly data reporting. Firstly, we will discuss the denominator for the weekly reporting. Facilities are asked to report on healthcare personnel that were eligible to have worked at the facility for at least one day during the week, such as individuals on leave or vacation. Please include individuals regardless of clinical responsibility or patient contact. Also, both full and part-time persons should be counted. Now we will talk about the different categories of individuals that make up the denominator. Similar to the annual influenza reporting, there are 3 required HCP categories. These consist of the following. The first category is employees, meaning staff on the facility payroll. The second category are non-employees. There are 2 types of non-employee categories: licensed independent practitioners and adult students, trainees, and volunteers. There is one optional category, which is other contract personnel. These are individuals paid through a contract and who do not fall into the licensed independent practitioner category. Here, we will go into more detail on the personnel categories. Employees are individuals who receive a direct paycheck from the healthcare facility. Next, there are non-employees. There are 2 types of non-employee HCP: licensed independent practitioners and adult students, trainees, and volunteers. Licensed independent practitioners include physicians, advanced practice nurses, and physician's assistants who are affiliated but not directly employed by the facility. Adult students, trainees, and volunteers are defined as medical, nursing, or other health professional students, interns, medical residents, or volunteers aged 18 or older that are affiliated but not directly employed by the healthcare facility. The last category of personnel are contract personnel. These are people who provide care, treatment, or services at the facility through a contract who do not fall into any other denominator categories. Now that we have discussed the denominator, let's go on to talk about the numerator. For the numerator for healthcare personnel, facilities will report on HCP receiving an influenza vaccination at this healthcare facility since influenza vaccine became available this season, HCP providing a written report or documentation of influenza vaccination outside this healthcare facility since influenza vaccine became available this season. HCP having a medical contraindication to the influenza vaccine. HCP declining to receive the influenza vaccine this season. And HCP with unknown vaccination status. This slide covers a few more points to keep in mind when reporting on healthcare personnel. A healthcare worker may be eligible to work in 2 or more facilities for at least 1 day during the week of data collection. If that is the case, then you would include that individual in your denominator for each facility. Also, it's important to note that the healthcare personnel categories are mutually exclusive. Each healthcare worker should be counted only once in the denominator. There are two questions on the data collection form that ask about availability of influenza vaccine throughout the influenza season. The first question asks about if a facility received its supply of vaccine for the current influenza season. The facility will indicate if vaccine was received, if only a portion of vaccine supply was received, or if vaccine has not yet been received. The second question asks about if a facility is experiencing a shortage of influenza vaccine for the current influenza season for each week. The facility will indicate yes or no when responding to the question. CDC has created a table of instructions document that provides definitions for the denominator and numerator categories and all questions on the data collection form. Facilities should review all instructions before collecting and entering influenza vaccination data in NHSN. Please use the link listed on this slide to view the instructions. Now we will briefly talk about the steps you will need to take to report weekly influenza vaccination data in NHSN. Once you are on the NHSN landing page, facilities will need to select the Healthcare Personnel Safety component in the drop-down box. Once you are on the home page for the Healthcare Personnel Safety component, click on the vaccination summary on the left-hand navigation bar. You will then see options for annual vaccination flu summary and weekly vaccination summary. For weekly reporting, click on Weekly Vaccination Summary. You will then see a screen in a calendar format for the weekly vaccination summary data. To report weekly influenza vaccination data, please click on the week for which you wish to enter data. You will then see the data entry screen for inputting weekly data. You will see that the fields with the asterisks are required categories. Select the correct influenza season in the drop-down box. For example, the current influenza season should be 2021 through 2022. Enter the data for questions 1 through 6 on vaccine coverage. Please note that the sum of questions 2 through 6 should be equal to the number listed in question 1. After clicking on the Save button, a message should appear on your screen indicating that the data have been saved successfully. Once data have been entered as saved in NHSN, you will see a tab for each existing record on the calendar page. To enter weekly data, click on the Flu Vax tab. After editing data, please click the Save button at the bottom of your data entry screen. Now we will go over how facilities can upload data through CSV files. Facilities are able to report data in two ways, either by manually entering into the application or by CSV upload. CSV upload is when users upload a comma-separated value file to an application. For NHSN, users can input their data into a CSV file and then bulk upload that data into the application. This method may be particularly useful for group and supergroup users so that they can upload data for their member facilities. Please also note that this data must be entered in a specific format. NHSN Vaccination has provided templates and examples to help aid with this data entry. Now we will go over the steps for uploading data through CSV file. The first step is to download the CSV template from NHSN website. The location of the document is shown in the screenshot in this slide. Also featured in this screenshot is an example template for user guidance. After downloading the CSV template, users should enter their healthcare personnel data into the file. The third step of entering data via CSV file is to upload the CSV file in NHSN. You will find the location for upload by following the instructions and screenshots shown on the slide. The last step of entering data via CSV file is to view your data to ensure it was uploaded correctly. Once you upload your data, you should receive the message in the screenshot. You can verify this by making sure the vaccination module populated with the uploaded data. If errors are found during an upload, a window displaying a description of these errors will be generated. Errors should be addressed in the CSV file, then re-uploaded into a message confirming successful upload is received. If you are having trouble with uploading CSV files, you can visit the NHSN vaccination webpage for resources and FAQs. Now we will go over how to report cumulative vaccination data in more detail. Firstly, we will address the question of what cumulative data are. Cumulative vaccination data are the total number of individuals in the facility who have ever received the flu vaccine since it became available. This is in contrast to incident vaccination data, which are the number of new individuals who received a flu vaccine in a specific week. Please note that incident data are not used for reporting flu vaccination data in NHSN. This slide shows you how influenza vaccination may be reported for employees who are eligible to have worked at the facility for at least one day during the week of data collection. In this example, the facility had 100 employees who were eligible to have worked at the facility for at least one day during the first week of data collection. 50 of those employees received influenza vaccination at the facility, while 10 other employees received vaccination outside of the healthcare facility and provided a written report or documentation of influenza vaccination. This example shows how influenza vaccination of employees looks during the second week of reporting. 10 employees received influenza vaccination at the healthcare facility during this week. So at the end of the second week, the facility reports that a total of 60 employees received influenza vaccination at the facility. During the third week, 10 employees received influenza vaccination at the healthcare facility. By the end of week 3, a total of 70 employees received influenza vaccination at the healthcare facility. The next few slides will outline some resources that may be helpful to you. This slide provides users with the link to the NHSN flu vaccination webpage. You can find the exact locations of these resources by following the screenshots. This concludes our presentation.